Good afternoon, everyone. My name is Rebecca Martonic. I chose to research in greater detail the topic of the independent self. My focus for this presentation is on the autonomy of adults in healthcare facilities. Independence is highly valued by all human beings, including the elderly. However, by the time individuals have entered a healthcare facility, they have lost a certain degree of autonomy. In order to be admitted to a nursing home, elderly adults must meet specific qualifications regarding physical and/or cognitive function. Prior to acceptance, they are required to participate in a pre-admission screening assessment, which evaluates their need for complex medical interventions, rehabilitation treatment, assistance with all or most activities of daily living due to functional limitations, or frequent supervision due to self-neglect, unsafe behaviors, and/or cognitive disabilities. Upon admission to the nursing home, elderly adults undergo a second assessment known as the CATS index tool. This tool measures the essential functions of bathing, dressing, toileting, transferring, feeding, and continence. The lower the total score, the greater the dependence and need for assistance. Many older adults are victims of ageism, that is, prejudice towards stereotyping or discrimination against persons solely on chronological age deemed to be old. Due to this preconceived idea, nursing home staff often disregards the residents' full capabilities and level of independence, offering more assistance than necessary. A natural assumption is that old age renders individuals functionally incapable of providing self-care. As a nurse, I have observed many staff perform simple tasks for the residents without first determining their level of independence. Daily activities are often structured in ways that leave little space for residents to make choices. While staying at my facility, individuals are required to follow a daily routine, which has been arranged by the facility staff. They participate in set meal times, pre-planned recreational activities, and scheduled therapy sessions. Paternalism is a behavior in which healthcare professionals substitute their own judgment for that of a patient when they feel that they have a better insight to the patient's medical needs than the patient himself or herself. As a nurse, one of my responsibilities is to report all new findings to the primary care provider. One day, I approached the in-house nurse practitioner with a specific patient concern. Stating that the particular patient in question often exaggerated the severity of her health condition, the nurse practitioner downplayed the situation and neglected to consider the need for interventions. In this situation, she was influenced by the mentality of paternalism. In general, nursing homes are structured to accommodate for the unique physical needs of the residents. Unless it is medically unavoidable, the nursing home must ensure that residents' abilities to carry out activities of daily living do not decline. To promote independence, self-efficacy, and safety, my facility supplies the basic durable medical equipment of side rails, toilet guards, wheelchairs, walkers. Many nursing homes provide an interdisciplinary team that focuses on helping elderly adults develop independence. For instance, occupational therapy aims to improve the patient's ability to participate in everyday activities that they find meaningful. The staff works with the elderly to improve and enhance ADLs and social participation through compensatory strategies such as modifying the environment and adaptive equipment. To encourage independence, promote a sense of empowerment, and ensure individualized interventions, the team will collaborate with the patients to create a plan that addresses the specific needs. They also aim to address the mental and emotional aspects of a person. OT uses psychological interventions such as cognitive behavioral therapy and problem-solving therapy to assist older adults in engaging in occupations that are meaningful and purposeful. In this way, the team aims to encourage coping strategies that promote autonomy, confidence, and emotional well-being. Regardless of the level of functional independence, residents of a nursing home are presented with many opportunities to make informed, autonomous decisions. On a daily basis, individuals are able to make independent choices in regarding to attire, meal choices, and social activities. Many healthcare facilities aim to provide activities that promote meaningful participation and dignity through experiencing enjoyable individualized activities, and then the residents are able to decide if they would like to participate in any or all of these scheduled activities. While still in possession of their cognitive faculties, many adults are assisted by healthcare personnel to create an advanced directive. Together, they consider various components of healthcare so as to ensure a personalized medical directive that includes a trusted person for making appropriate decisions, goals and values about healthcare, medical treatment to be implemented or avoided, and where to receive interventions. In this way, an advanced directive provides adults with the opportunity for their wishes to be honored by their family, power of attorney, and healthcare staff. A number of healthcare providers allow the vulnerability of elderly adults to taint how they view their patients' cognitive and physical abilities. Providing all cares and making decisions for their patients, they merely inhibit any growth and independence. This suggests that those who are in a nursing home do lose a certain degree of autonomy. However, such a claim has raised controversy as research shows that respectable nursing homes make concerted efforts to support self-sufficiency and self-efficacy. Many professionals strive to encourage empowerment by providing their residents with various opportunities to develop independence and to make informed decisions. Therefore, it may be refuted that elderly adults can preserve their independence and autonomy even while living in a nursing home. Thanks for your attention, and I hope you all have a great Christmas.